Hey everyone, it's Wednesday. Hope you all are doing well. I don't know about you, but I've had a long day, so I won't keep you long today. I wanted to continue a little bit on our series that we're doing about supplements. Last week we talked about omega-3 fish oil, and this week I wanted to talk about B-complex and methylated B vitamins or activated B vitamins. We know that in a person who is having difficulty keeping their B vitamin levels up or have low B vitamin levels, there are increased risks for certain entities, for instance, depression. A lot of our neurotransmitters in our brain have cofactors that are important in the production of our neurotransmitters, and B vitamins are very essential and important. So low B vitamin levels can increase your risk for depression. Also, we know with energy, a lot of folks do well getting B12 injections, and that can be quite helpful. It's hard to keep B vitamin levels up, especially in our stressful world. We tend to use them and just sort of eat them up, so to speak. So we need to give the body plenty of B12 and folate and B6, all part of that B vitamin family or complex. We know that it increases your cancer risk, cardiovascular risk, and in women who are in their reproductive ages can increase birth defects and malformations when certain B vitamins are low, particularly folate or folic acid. It can increase your risk for autoimmune disorders, as well as people can be photosensitive when their levels are low. And one of the tests that we check in our office, particularly once a year for our patients, is a test called homocysteine. And that particular test is very sensitive to a process in the body where a methyl group is rotated from folate to B12. And it's this methylation aspect that we now have the ability to check for genetics, and many people have mutations in their genes that make their ability to methylate or convert this methylfolate to methyl B12. They have genetic changes that reduce their ability to do that in the body. And as I tell many of my patients, when homocysteine levels go up, it means that we're not able to use that little internal engine to move that methyl group from folate to B12, and therefore homocysteine levels go up. Just as if you're on a freeway, an 8-lane freeway, so to speak, and there's a large traffic jam and it goes down to 2 lanes and everything backs up. That's what happens in this instance. Things are just slowed down and it takes a while to clear that particular amino acid in its pathway, and therefore we don't detoxify very well. We have more increased inflammation. The impaired detoxification can be a real problem, and so our liver can't process certain things. So one of the things that we know is that if you take activated B vitamins, not the type that you can get at CVS or at Walgreens, but those that are methylated. So you'd want to look at a product that would have a methylated cobalamin, which is the methylated B12, and methylated folate or 5-methyl tetrahydrofolate. That is an activated form of folate. And then for B6, you want what's called the P5P form, or a pyridoxine 5-phosphate form of B6. B6 is exceedingly important for particularly neurotransmitter production and therefore brain health. So when we recommend B vitamins, we always want to recommend a product that is going to have these activated forms. So when you have the chance to look at what you're taking, make sure that you're getting those. And if you have any questions or concerns, we can certainly help you with that. You can always do some of your genetic testing too to see, do you happen to have one of these genetic type changes that makes you less effective in this process. This is a gene called the MTHFR gene, and we have a couple of those in the body, and most of us have some challenges in that area, so that perhaps we may not be 100% methylator, but perhaps maybe a 75% methylator. So just to kind of give you a brief overview of B complex and B vitamins and their importance. And if you do happen to have a high homocysteine level, it's very important that you take a significant dose of the methylated folate so that you can clear that, because it does have impact on clotting and increased risk for cardiovascular disease and strokes. So just a quick brief review of B vitamins. Hope that helps you a little bit. I'm off. It's been a long day. You all have a great day, and we'll talk again next week.